I'm Brian Hendon. I'm the founder and president of Apollo Applied Research and Apollo Cannabis Clinics, which we believe to be the finest cannabis research entity in the world.
Apollo began as a passion project to answer the unmet needs of patients suffering with pain.
I founded Apollo to empower patients. I actually co-founded another pain practice, and in that practice we had brilliant physicians and patients suffering. Patients were telling physicians that medical cannabis is more effective for them than the treatments that we were giving them. And physicians wouldn't prescribe it because there was no research. So that's what Apollo does today. We prescribe medical cannabis to patients using validated measurements. We've developed probably what we believe to be the most effective medical cannabis treatment program in the country.
I'm Dr. Paula Williams. I'm a family physician in Toronto. I have a family practice with a focus on pain management.
Dr. Williams prescribes medical cannabis for patients suffering from a variety of illnesses, including pain, which can be very complex to treat.
I came to know cannabis because patients told me often enough that I began to realize that they were using cannabis, say illegally at the time, maybe 20 years ago, and benefiting from it. And I became very interested in it. Any modality that helps pain patients is fascinating to me because a lot of things don't help them.
Medical cannabis has proven to greatly reduce the severity of pain and reduce patients' use of opiates.
And I've had very great success with patients' use of medical cannabis over the last 10 years.
Recent research has reinforced cannabis as a treatment for pain, and it is also determining to be effective within the interrelated areas of anxiety and sleep.
In 2014, Apollo created our first observational study. It was a large-scale observational study looking at patients suffering with chronic pain. What we found in that research study was medical cannabis is an incredibly effective treatment, but it's not just incredibly effective for pain. It's incredibly effective for sleep, anxiety, and overall quality of life.
Every day that I see patients, I get good news stories. What I'd like Canadians to know about medical cannabis is that it's going to be easily available, it's worth trying. It's very important to gain knowledge about it before trying it from a reputable source.
For best outcomes, it's important that patients are treated with personalized treatment plans that reflect their individual needs, goals, and level of comfortability with cannabis as medicine.
Apollo is different than your typical practice. So when patients first come to Apollo, they're first triaged. They see a healthcare professional who really does a background assessment on the patient. After that, the patient goes on to see a physician. And that physician makes a decision on what strain of cannabis is going to be the most effective for them. And after that, they go on and see an educator. The educator spends a lot of time working with the patient to really help to tailor the medication specifically for them and their needs.
Cannabis is a very personalized medicine.
So medical cannabis is made from marijuana plants, and different strains can be grown with different names. And some have more or less THC or CBD.
Cannabis is not a one-size-fits-all. Medical cannabis is the definition of personalized medicine. Every strain of cannabis is unique, and every person is unique. So it's really a matter of finding the right strain that suits each individual.
The cannabis plant itself is extremely complex. It's important for patients to work with qualified healthcare practitioners to discuss the appropriate strains, routes of administration, and dosing best for them.
Patients do much better if they have education and support, either from their physician or from a clinic. It's hard for a lot of people to find a physician who knows a lot about medical cannabis.
Patients do not require a referral to come to Apollo.
It is Dr. Williams' hope that patients who are dealing with pain, sleep, anxiety, and other symptoms or conditions know their best options. Medical cannabis is medicine.
There's more options than they ever imagined. Surely something will appeal to them. It may be just a few drops on a cookie, but they should give it a try, not be afraid.
I could have never imagined how rewarding it would be working with Apollo. Every single day we see somebody that we've transformed their lives. They went from being in incredible pain and having a terrible quality of life to being able to do things that they couldn't do. There was a lady who was actually handicapped and was dancing at her daughter's wedding. That's really why we do what we do.
Educating oneself about medical cannabis empowers patients. For those who are interested in learning more about medical cannabis for themselves or a loved one, please talk to your family physician or contact the clinic directly.